I'm Dr. Stu. I'm both certified family medicine and sports medicine doctor. And I recently had a patient who came to my office and his blood pressure was 150 or 80 millimeter mercury. And he told me that he's got white coat hypertension. So basically what that means is that, so whenever he sees a white coat, he develops a little bit of anxiety and thereby causing the blood pressure to go up. So now I cannot depend on the blood pressure readings that I have in the office right now. So I told him to check his blood pressure outside office. So basically, sometimes I'll tell people to get an automatic blood pressure monitor and check their blood pressure at home, but he could not afford a home blood pressure monitor. So he went to an external site to get his blood pressure checked. And now he comes back to the office with the blood pressure readings, and his systolic readings, which is basically the top number readings, are between 140 to 145 most of the time. And his diastolic, which is the bottom number, is between 80 to 85 most of the time. So now based on the American Heart Association, so this one would be classified as stage 2 hypertension, and the recommendation is to consider a medication. Now the question is that just because I've got the blood pressure numbers that have been performed outside office, are they still reliable? Are they still accurate? Was that blood pressure correctly measured or not? So that's a question. So I have to make sure that these blood pressure readings are accurate because my decision making is based on these numbers right now. So fortunately, I had an opportunity to observe the process of the external site, and I identified a lot of improper techniques. So number one, the patient's arm was hanging down. Number two, the legs were unsupported. Number three, the cuff was not positioned at heart level. A recent study in October 2024 revealed that such positioning can cause a variance of 4 to 6 millimeter mercury both in systolic, which is the top number, and the diastolic. So if I correct for this error, the patient's true readings would be somewhere closer to 138 millimeter mercury systolic and 79 to 80 millimeter diastolic. So the patient's blood pressure is genuinely less than 140 systolic and less than 80 diastolic. In that scenario, I would not consider medication right away. I would probably consider lifestyle modification first for at least 3 months or so before I consider medication. As you can see, how important it is to make sure that the blood pressure readings are accurate, because that could change my medical management. So let's now review the correct way to measure blood pressure. My nurse Pam will demonstrate the proper technique. First, ensure the patient rests for 5 minutes before taking the reading. It's important not to engage any strenuous activity immediately before. All clothing covering the cuff location should be removed. The individual should sit with legs uncrossed, feet flat on the floor, and arm supported heart level. This can be accomplished easily by having the patient rest their arm on a desk or a table. Ideally, the middle of the cuff should align with the middle of the sternum. If using an automatic blood pressure monitor, adhere to the same principle. Neither the patient nor the person taking the measurement should talk during the procedure. Talking during the procedure may cause deviations in the measurement. When choosing a cuff, make sure the bladder length is 80% of the patient's arm circumference. This means that the length of the bladder, the inflatable part within the cuff that wraps around the arm, should cover 80% of the distance around the patient's upper arm. So my arm circumference is around 32 centimeter, which means that I would use a small blood pressure cuff instead of a large blood pressure cuff. So make sure that you adhere to these guidelines to ensure that you get accurate blood pressure readings all the time. If you found this video helpful, please make sure to hit the like button so this video can reach more people. If you want to know more about the best exercise that can lower one's blood pressure, then check out this video here. And I'll see you in my next video. Until then, goodbye.